Hi everyone, CaRMS applicants. My name is Dr. Laura Marcotte. I am a general internist at Queen's and the program director of the GIM program here at Queen's. This is a weird year for us. It's very strange doing CaRMS during COVID with restrictions on interviews. At Queen's, we really like to make the interview day a day. We like to meet everyone, have a nice lunch. So it's a little different for us to do this remotely. I wanted to give you a chance to see what I usually present at our CaRMS interview day though, just to give you a bit of an idea about what the program is like at Queen's. I know pretty much nobody was allowed to go on electives, so we haven't had a chance to meet many of you and you haven't had a chance to come here for electives. So hopefully this gives you a bit of a sense of what we offer. I would say too at Queen's, we have great internal candidates. We love getting internal CaRMS matches, but I also love to get people from other centers because I think it's really good for our program to have a mix of internal and external candidates. So I hope that some of you who are considering Queen's really think about it and think about what you might get out of a GIM fellowship here. So without further ado, welcome to the GIM program at Queen's. We'll talk a little bit about the program, a little bit about COVID-19 changes, which actually hasn't been very much for us, a bit about CBME in case you're wondering, and a bit about Queen's, the institution, and Kingston as a city. So our program is fully accredited. We passed our last on-site accreditation in 2018 with flying colors and no major weaknesses. We have 4 PGY4 spots in the next match, and in our program you function mainly at the junior attending level. You work with 60 to 70 residents in the core program, and you do mostly fellow level, junior attending level rotations. And graduates in our program have gone on to careers both in academic medicine as well as community medicine in a variety of different ways. Where we work, Kingston Health Sciences Center, which is actually 2 hospitals. KGH, Kingston General Hospital, is where all of our inpatient and complex work goes on. And Hotel Dieu Hospital is an ambulatory site. Although it's 2 hospitals, the staff, the faculty that work at both are exactly the same. They're located just a short walk across the park from each other. And many times of the year, this would be your walk going from one to the other. So although it's 2 hospitals, it operates very much like one institution, which is a bit different from other centers. For community rotations, our standard rotations happen in Oshawa, Ontario, and Humber sometimes, which is a Toronto community hospital. But we have many opportunities for community GIM electives, and our trainees have done community GIM electives all over the place. KGH is a tertiary quaternary care teaching hospital. People often wonder, oh, Kingston's a small city, will I get to see the same breadth of medicine that I would see in a bigger center? And the truth is, yes, you will. We have, although it's a smaller size city, we have a large catchment area going all the way from Coburg in the west to Cornwall in the east and up north to the Indigenous communities along James Bay. It's a busy hospital and you'll see lots of medicine. Other things about KGH, part of it you may not know, part of the old hospital was the site of the first Parliament of Canada, but that part's old and mostly offices. The hospital part has some brand new medicine wards and expanded ICUs, so many of the areas you work are not 150 years old, but are newer. There's a new cancer center, new dialysis unit, we have teaching rooms, computers available for when you're on CTU, the foyer, cafeteria have been renovated. Queen's, as the university, has a brand new medical school building, which is quite lovely. There is an extensive state-of-the-art simulation lab there that we use that I think is actually the envy of some larger centers. And as you all probably have heard by now, Queen's has been a leader in CBME. More to come on that later. In our division, we have 14.5 full-time equivalent general internists with a broad array of interests. So you can see the list there. And if there's anything that catches your eye, you know that there's somebody here who is the point person or a connection if you are interested in that area of expertise and want to do research or more clinical training. There's also a big focus on medical education within our division. We have, as well as the GIM program director, myself, obviously, there's the core IMPD, the associate PD, the ex-core IMPD, the clerkship coordinator all live within our division. So there's a real focus and attention to medical education. In our program, in 2 years, you will do these blocks. And the asterisk is there because this is on average what most people do. But the caveat is with CBME, you know, we really attend to what do people need? What have you done? Do you need more? Do you need less? But in general, you'll do 2 blocks on regular CTU as junior attending, 1 each year, and 4 blocks, 2 each year of our split CTU-E, which is our short stay unit mixed with GIM consults, block of community GIM, a block of ICU. Most residents end up doing 2 blocks of ICU, first in our community center, which is really well received, and then the second here at KGH for the sort of quaternary level ICU. 2 months of obstetric medicine and peri-op, which is primarily ambulatory here in Kingston, a block of cardiac electrodiagnostics like you would everywhere, a block of ambulatory medicine, and this we've developed, it's actually quite flexible, and the residents design it according to what chronic disease or ambulatory medicine clinics you want to incorporate in it. So that makes it very personalized as an outpatient ambulatory rotation. And we do still send residents for a block of obstetric medicine at another site, often U of T, but our residents have gone many different places. The reason for that is our OB medicine here is quite robust for the everyday OB medicine issues, but our residents go away for this block at an area of specialization, and they come back so much stronger that we are sending everyone still, because I think it's a really good experience. Which leaves you with 13 blocks of GIM's electives, and the selectives traditionally are electives at your own site. We're very flexible on this, and residents use these 13 blocks in a variety of different ways. And the standard approach from our program is that if there's something you want to do and there is academic value and there's a supervisor available, then we will make it work. And so people have used this to do a lot of really creative different elective rotations. So there's a lot of flexibility there. When you're the junior attending on acute medicine wards, the way our wards work are we have very small subspecialty inpatient services. So when you're on CTU, your patient population is actually quite broad. It's an excellent case mix of a lot of different acute medicine that you might not see everywhere. We also still, I believe, are the only institution to have an open level 2 ICU. So your patients on CTU who need BiPAP or amiodarone or DKA, you manage that yourself on CTU. And so you get the continuity of care for that patient when they get a bit more unstable and then they get a bit better. And I really think this is a highlight of training here. You get a lot of longitudinal exposure to those patients who aren't critically ill, but need that little bit of extra nursing care. And we continue to look after those patients on CTU. They're always talking about closing it, but they've talked about that for about 15 years now. So I'll believe it when I see it. The other thing that we have, which is I think a strength, is we do have a hospitalist service run by a family physician who takes the ALC patients off the medicine CTUs and cares for them. So it lowers the burden of ALC patients on our CTU wards, which is great. I mentioned that CTU-E is our ER-based short stay unit team. It's a little bit different this year with COVID, but essentially that's a rotation that developed. It's very high turnover, lower acuity, so it gets you a lot of exposure to reviewing consults, seeing a lot of patients, making decisions about admission versus discharge from emerge, and the fellows love that rotation. And of course, we have a medicine inpatient consult service like you probably all have at your home institutions to look after medical issues on surgical and other inpatients. Another strength of our program is the Fellows Urgent Clinic, and this we run twice a week. You wouldn't be in it every clinic, but you'd have a few a month probably. And this receives urgent referrals from emerge or the community, but it also gives you an opportunity to follow up your patients, whether it's patients you've seen and discharged from CTU or from the GIM consult service. Gives you an opportunity to have that continuity of care and follow them up yourself. We run it with the fellow as the MRP and the faculty rotate through. You get business cards, you have a dedicated admin. And so these are your patients, and over the 2 years, you manage your own roster of patients and develop the skills to do that. Educational rounds, like most other academic centers, we have lots of rounds that are available to attend. There are departmental rounds, sign-in rounds, which is sort of like a morning report for the core residents, medical mortality rounds, grand rounds. You're invited to all of these. Within our division, we run weekly rounds, which is a mix of journal club, case rounds, peri-op, OB, sometimes invited speakers. We often have cardiology and GIM joint journal club out at a restaurant. Lots of opportunities for teaching juniors as well. I think I mentioned some of those already. We have simulation sessions when you start as a PGY4. So the way our academic half day is broken up, the first 6 months are separate for the PGY4s and 5s. The PGY4s do simulation sessions at the beginning and have some introductory GIM topics, and the PGY5s do a critical care series as well as a lot of transition to practice topics. And then it's joined sort of in the middle of the year for a rotating schedule of interesting medical and other topics, which I think works really well, if I do say so myself. So just a word about COVID-related changes, because I think things have been different in many programs across the country. And really for our program, the COVID-related changes have been minimal. So, you know, many of our fellows had electives canceled at other schools, and so they had to come home, but we have the capacity to find nice GIM-related rotations for everybody, so that worked out well. CTUE, which is our short stay unit, has become the COVID ward. So that's been a little bit variable and fluctuating and evolving constantly, but still runs reasonably well. We've had very low COVID incidents in Kingston. Our fellows clinic still runs in-person visits and also some telemedicine. Peri-op and OB clinics still running. And the telemedicine has evolved. The residents have been fully involved, and so that's been an opportunity to learn and participate in a new skill. So that's gone well. And our fellows really haven't missed out on any opportunities because of the COVID restrictions, which is important when you have a short training program. And really importantly, none of our fellows have been redeployed for service requirements, nor are we anticipating that that would ever be requested, nor have they been asked to do any sort of core IM call or rotations. And I know that has happened also in other centers, not here. So strengths, I think, of our program are we have a really good, strong academic half-day series, particularly in the PGY 5-year, a lot of readiness for practice topics that are important when you're thinking about going out and starting your own career. Our fellows clinic runs really well and is always something that the fellows enjoy, and at the end of their training they recognize how important it is in the development of those ambulatory medicine and managerial skills, because you are able to look after your patients and we help you along the way. And you get increasing levels of independence and responsibility. Lots and lots of flexibility and individual attention in our program. And I think that's probably the #1 thing that I would offer to you, potential candidates, is that we have a lot of flexibility. And so if you have ideas about what you want to do for your career or your training program, we can probably make it happen. And we have done all kinds of different things for our different fellows. And the whole focus of our program is really to focus on getting trainees ready for their career, whatever that looks like, whatever they need. I think the reason we can do that is we have a small collegial group of faculty and fellows, and you hear that a lot about Queen's to the point where it becomes a little bit of a cliche, but we really are a small collegial group and we work really well together and we care about each other and attend to each other and help each other, and we take that approach to the fellows. So it's not just myself as the program director and Carolyn as the program admin. I think all the faculty take this approach to helping our fellows figure out what they want to be when they grow up and help them get there. Oh yes, and we really do have this CBME thing nailed. A few words about fun in the Queen's GIM program. So, you know, before COVID, we had a lot of events because we like to spend time with each other. We like to get to know our fellows, and we are a close-knit group. We had a welcome barbecue, holiday party, resident retreat, goodbye parties, convocations. This is a little bit put on hold in the COVID environment, and so I very much look forward to restarting some of these things. But I'll leave you with some pictures of this is our division and our fellows, and we enjoy spending time with each other. Yes, we have done laser tag and axe throwing. And escape rooms. So a little bit about CBME at Queen's. I won't bore you with too much detail. I think all of you have now been introduced to CBME in your core IM programs, and hopefully you have a decent understanding of the background. But essentially, you know, the Royal College is transitioning every program to be competency-based, and that's what we're doing. So the whole idea of CBME is, rather than showing up, spending 2 years in a program, and then leaving with a final exam, it's an outcome-based system where we identify what we're looking for in our trainees in a stepwise fashion, and we help you get there by paying attention and doing lots of observation and assessment along the way. As you know, this is the Royal College Competence Continuum. You go through these steps for every single program. So although you've done 3 years and you've done some of these stages of training in your core IM programs, when you start a new program, you go through all of them all over again. So we have the same stages of training in general internal medicine. And so CBD is the Royal College's approach to implementing CBME. And they've gradually rolled this out over time. They're kind of in the middle of it. And GIM as a national specialty rolled out last summer. So they've done it for 1 and a bit years. Queen's, though, decided to be different. And so our dean at the time decided that all postgraduate programs at Queen's would be fully competency-based as of July 2017. And so that meant in the years leading up to July 2017, there was a lot of work done. And so many of the CBME elements were in use in the years prior to 2017. And so bottom line is we've been doing this for a long time now. And I think it's hard to appreciate, but in a center where we all did it all together, the school and institutional resources are in place. Whether you're in GIM or a cardiology rotation or in the ICU, everybody knows about CBME, everybody gets it. And this culture of feedback and coaching, which takes time to initiate and to develop, has been going on for the last few years. And so you will not be the guinea pigs. So what does this mean for you as incoming GIM fellows? So this culture shift in coaching and feedback has already happened here, and we've seen that in our faculty. At the beginning, it was a bit of a struggle, and it was hard to get everybody to understand what was needed, and maybe you're seeing some of this at your home institutions, but that's long past. Everybody here is on board, everybody gets it, people give feedback very easily, and we have been working with this system of EPAs and assessments for a long time now, so it's smooth, and our processes work really well. So for you, what this translates to is really clear expectations and direction, lots of feedback and assessments, which get collated into this bigger picture, and you meet regularly with your academic advisor to go over things. And so, you know, I used to go into a lot more detail about this, but I think you guys get what CBME is about now. And I just want you to picture 2 residents, because we always talk about CBME in terms of the struggling resident who's having a difficult time and, you know, needs the personalized attention and observation, and then we can pick up where you're struggling and offer you lots of helpful tips and extra rotations or training to help you get where you need to be. And that's true, and it happens, and it works great. But I think most of you do not see yourselves in that resident. So most of you, and I can tell from the applications, are superstars and have done a lot, and it's harder to appreciate the value of CBME. But what I would suggest is that there's equal benefit to CBME for superstar residents, because what do you get on your assessments? You get good work, no issues identified, pleasure to work with, look forward to working with you again, did a great job. And in terms of your professional development, that's not actually very helpful. You can be a superstar resident and still get really specific directed feedback about, you know what, when you saw that patient, I really liked the way you did this. Here's something that I do in my clinic, or I try this sometimes. Next time, think about wording it this way. There's all kinds of little clinical pearls that you can still get, and direction that you can still get to become even better. So bottom line, CBME is not just for struggling residents, it's for all residents, because what it means is it's attention to you, your personal strengths, weaknesses, needs. You also get a dedicated academic advisor to sift through all the assessment data, the feedback that you're getting, meet with you, provide the context, guidance, coaching, and that's a really important part of CBME, because a whole ton of assessments doesn't mean anything if you don't have somebody to walk through it with you and help you make sense of it and identify overall themes and patterns. And then we adjust your academic plan, meaning your rotations and what you're doing with your time to meet your needs, whatever it is that you want, even especially if you're doing well. What I would say though is that this requires from you an openness to receiving feedback. So many people are very sensitive to receiving feedback and don't like to receive feedback. And I'd say, you know, if you're someone like that, then maybe think twice about coming. We are a wonderfully collegial, supportive environment, and our feedback is fantastic feedback, but you have to be open to it. And that's a really important part of engaging with CBME. And we will ultimately make you a superb general internist. So a little bit about life in Kingston. For those who have never been here, it's hard to imagine how good life can be in Kingston. It's a smaller center, about 140. It is officially a bilingual city, so you can access services in both languages. It's a university city, and so that means, you know, every September we have this influx of undergraduate students, and then they go away at the end of April. But it invigorates the city a little bit, and so we have a lot more stuff than you would maybe find in a smaller city of the same size without the university. So we have lots of restaurants. Everything is easily accessible. Bigger cities, other things are nearby, consistently ranked highly in Canada's best cities to live in. And part of that is cost of living, the environment. Rent is very reasonable. Most residents walk or bike to work. Everything's within a very small area downtown along the water. Kingston outdoors, there's so many opportunities to get outside the city, and by outside the city, you can drive for 10 minutes. A lot of this is within the city. Lemoyne Point Conservation Area is near my house, and it's a beautiful place to walk. Lots of conservation areas. You may notice this picture on the top right of your screen. This surfer is actually surfing right in front of the hospital. So that's our hospital right there, KGH. Oh, this is me and my two kids from quite a while ago, actually, at one of our favorite places. Kingston for Families has lots. There's water park splash pads, lots of things to do, newly developed waterfront park, lots to do in summer. I have heard repeatedly that we have the most bars and restaurants per capita of any Canadian city. Lots to do in winter. And lots to do in the greater area around Kingston. So ultimately, why come to Queen's? Because we will give you excellent clinical training and really will give you attention to your learning and your needs within the CBME program. We have a lot of flexibility to build a 2-year program based on your personal career goals and needs, and we'll be very supportive and approachable. We have a great group to work with you. And I think ultimately high quality of life in a medium-sized city. We're all busy, everything's busy. It's really important to have good quality of life outside and beside your quality of work. So unfortunately, you couldn't come to Kingston to see a little bit of this, but hopefully this gives you a bit of a taste of why those of us who've come to Queen's have stayed at Queen's. If you haven't looked at our video, then please give it a watch. It's a few years old, but I think it still highlights a lot of the things that are great about Kingston and our program. And I know we will send it out with our mail out. And you're not visiting, but enjoy the CaRMS interview process. I'm looking forward to meeting a lot of you during the interviews.